Greetings and welcome. Across every continent, in every culture, and in every stage of life, humanity shares a common vulnerability: disease. Despite unprecedented advances in medicine, technology, and public health, illness remains one of the greatest forces shaping our world. These threats are often invisible. They do not respect borders, wealth, education, or geography. From densely populated cities to the most remote regions on Earth, disease continues to challenge global health systems and individual lives alike. In this documentary, we explore 10 of the world's most impactful diseases, not as isolated medical conditions, but as global forces that affect families, communities, and entire nations. This is not a story of fear. It is a story of awareness, science, and resilience. The global burden of disease. Among the most significant threats worldwide are cardiovascular diseases, including heart attacks and strokes, which remain the leading causes of death globally. These conditions are strongly linked to lifestyle factors such as diet, physical inactivity, smoking, and chronic stress. But they also reflect deeper social and economic inequalities. Close behind are cancers, a broad group of diseases that can affect nearly any part of the body. While survival rates have improved dramatically for many cancer types due to early detection and targeted therapies, cancer remains a major global health burden. Chronic respiratory diseases, including chronic obstructive pulmonary disease and severe asthma, continue to affect hundreds of millions of people. These conditions are often associated with air pollution, occupational exposures, and tobacco use, factors that disproportionately affect vulnerable populations. Diabetes, particularly type 2 diabetes, has increased rapidly worldwide. Once considered a disease of affluence, it now affects people across income levels. Driven by urbanization, dietary changes, and reduced physical activity, complications from diabetes impact the heart, kidneys, nerves, and vision. Neurological disorders such as Alzheimer's disease and other forms of dementia are becoming more common as populations age. These conditions do not simply affect memory, they profoundly alter identity, independence, and family life. Lower respiratory infections, including pneumonia, remain a leading cause of death globally, especially among young children, older adults, and individuals with weakened immune systems. Kidney disease and chronic liver disease often progress silently for years before symptoms appear, making early detection critical. These conditions are frequently linked to diabetes, high blood pressure, viral hepatitis, and excessive alcohol consumption. Despite being preventable and treatable, tuberculosis continues to claim lives each year, particularly where access to healthcare is limited. And while major progress has been made, HIV remains a global public health challenge, now managed as a chronic condition for many, but still deeply affected by stigma, inequality, and access to treatment. Together, these diseases represent not just statistics, but millions of individual stories. Who is most affected? Understanding age and sex differences, disease does not discriminate, but it does affect populations differently. Some conditions show clear patterns across age and biological sex. For example, prostate cancer occurs only in males and becomes more common with age, while osteoporosis is more prevalent in postmenopausal women due to hormonal changes. Alzheimer's disease and dementia are more frequently diagnosed in women. While longevity plays a role, researchers now understand that biological, hormonal, and genetic factors also contribute, not simply lifespan alone. Heart disease, often mistakenly viewed as a male-dominant condition, is actually the leading cause of death among women in many countries. Symptoms in women may present differently, which has historically led to underdiagnosis and delayed treatment. Children face unique risks as well. Their developing immune systems make them especially vulnerable to infections such as pneumonia and diarrheal diseases, still major causes of childhood mortality in some regions. In the case of HIV, young women in certain parts of the world remain disproportionately affected due to biological susceptibility. gender inequality, and limited access to education and healthcare. Recognizing these patterns is not about labeling risk. It is about improving prevention, early detection, and equitable care. Global progress and medical advances, while these realities are sobering, the story does not end there. Across the globe, scientists, healthcare workers, and public health leaders are making meaningful progress. Advances in diagnostics, precision medicine, vaccines, and digital health tools are transforming how diseases are detected and treated. Vaccination programs have saved millions of lives and continue to prevent outbreaks of once devastating illnesses. Public health campaigns now focus not only on treatment, but on prevention, promoting healthier environments, cleaner air, safer water, and better nutrition. International collaboration plays a critical role. Governments, research institutions, nonprofits, and private organizations are increasingly sharing data, funding research, and responding collectively to health threats. Progress may be uneven, but it is real. What we can do as individuals, while global systems matter, individual choices also play a powerful role. A balanced diet, regular physical activity, adequate sleep, and stress management are foundational to long-term health. These habits reduce the risk of heart disease, diabetes, certain cancers, and cognitive decline. Avoiding tobacco, limiting alcohol consumption, and reducing exposure to environmental pollutants can significantly lower disease risk. Vaccinations remain one of the most effective tools in modern medicine, protecting not only individuals, but entire communities. Routine medical checkups allow for early detection when treatment is often most effective. Preventive care saves lives. And perhaps most importantly, staying informed, using credible, science-based sources empowers us to make better health decisions. Closing narration: disease has shaped human history, but so has our response to it. Every discovery, every prevention effort, and every informed choice brings us closer to a healthier future. Understanding these global health challenges is not about fear. It is about awareness, responsibility, and hope. Because every step toward knowledge is a step toward prevention, and every informed decision is an investment in life. Thank you for watching. If you found this video valuable, smash that like button, subscribe for more insights, and share it with friends who needs to hear this.